Welcome back to The Explainer. Today we're tackling something that, frankly, gets a lot of sensational headlines. But when you really break it down, hantavirus isn't some unpredictable, scary monster lurking in the dark. It's actually a strictly mechanical system. We're going to map out exactly how hantavirus transmission works, treating it as a very precise sequence of actors, transfers, decisions, and failure points. Because, by understanding the mechanics of this virus, from that initial environmental trigger all the way up to the macro-level public health response, we can see exactly how the system functions, and more importantly, we figure out exactly how to stop it. Right, let's run a quick system diagnostic check to see what we're covering today. First, 1, the system of contamination. Then 2, pathways, inhalation, and interruption. After that, 3, the diagnostic bottleneck, followed by 4, the Andis virus exception. And finally, 5, containment and system management. Let's get right into it. Section 1, the system of contamination. Now, to truly understand this system, we really have to look at the everyday setup, where biological and human actors unexpectedly cross paths. We're going to ground this complex science in a really tangible, everyday scenario backed by established evidence. Picture this. A closed cabin, or maybe just a backyard shed you haven't opened since last summer. You walk in, grab a broom, and start sweeping out some mouse droppings. In the mechanics of hantavirus, the physical environment itself is a major actor here. A poorly ventilated enclosed space literally acts as a containment vessel for the virus. And when you bring a broom into that closed system, you're initiating a sequence of events. A closed cabin, a broom, a systemic failure. You are entirely unknowingly acting as the catalyst that activates this pathogen. So let's walk through this biological handoff step by step. Step 1 is the rodent reservoir. Now, in the Americas, this is quite often the deer mouse. The virus lives inside the mouse without actually making it sick. Step 2 is contamination, where the virus is shed into the environment through urine, droppings, saliva, or even nesting material. Now, here's the catch. If left perfectly still, this system is completely dormant. But step 3 is our major failure point, dry disturbance. Human action, like that sweeping we just talked about, disturbs the excreta, and that triggers step 4, the final pathogen transfer, which is airborne inhalation. Just like that, a perfectly normal everyday chore completes the mechanical circuit for an infection. Moving on to section 2, pathways, inhalation and interruption. We've pinpointed the hazard point, so let's zero in on the exact mechanism of this transfer and the specific decision that can totally prevent the system from failing. The absolute defining mechanical term here is aerosolization. It's a matter of established evidence that when you agitate dry rodent droppings, the virus literally gets launched into the air as these tiny invisible particles. And I want to be crystal clear here. Based on the data, hantaviruses are absolutely not arboviruses. You're not going to catch this from a mosquito bite. Now, the primary pathway is this aerosolized mechanical transfer. You breathe in the dust, and the virus enters your respiratory system. It's a pure and simple environmental transfer. And the contrast between failure and safety here is honestly striking. On one hand, you have a highly preventable failure point, dry sweeping, or even vacuuming. Actually, vacuuming is a massive hazard because it can blow those microparticles right through a standard filter and blast them back into the air, making the exposure so much worse. But on the flip side, we have a clear solution: system interruption. By using a wet disinfection method, specifically a 1 to 10 household bleach solution, you weigh down the particles so they physically can't become airborne. Plus, the bleach chemically neutralizes the viral hazard on the spot. It's just a brilliantly simple, perfect interruption of that transmission pathway. That brings us to section 3, the diagnostic bottleneck. Now we're shifting our analysis from the external environment to the internal clinical constraints, where the human body actually ends up inadvertently masking the incoming threat. Look at this massive gap, 1 to 8 weeks. That is the incubation period. It's wild to think about, but an individual can inhale aerosolized hantavirus, and that pathogen can just sit there, silently replicating in the human system for up to 2 entire months, before a single symptom even appears. By the time the alarm bells finally go off, the patient might not even remember cleaning out that old shed in the first place. Breaking down the timeline of what happens next reveals a pretty severe clinical gauntlet. In the early phase, which lasts about 2 to 8 days, the symptoms are honestly relatively mild. We're talking fever, severe muscle aches, maybe some nausea. The clinical constraint here is that this perfectly mimics the flu or even something like appendicitis. And that creates a massive diagnostic bottleneck because doctors naturally might not suspect a rare virus right out of the gate. But then, 4 to 10 days post-onset, the late phase hits, and the system just rapidly deteriorates.
In the Americas, this often manifests as Hantavirus pulmonary syndrome, or HCPS, where the lungs rapidly fill with fluid. Over in Europe and Asia, it usually presents as hemorrhagic fever with renal syndrome, which attacks the kidneys. Because of that initial diagnostic bottleneck, patients very often arrive in the ICU already in a state of rapid, life-threatening systemic failure.
Section 4, the Andes virus exception. So, let's explore how all this builds into a highly documented anomaly within the overall hantavirus system, one that actually breaks the normal transmission rules.
We've firmly established that hantavirus is a rodent-to-human system, but you might be wondering, can it bypass that entirely? Well, for almost all of the 40-plus known strains of hantavirus, the answer is a hard no. They do not spread person to person. However, we have to make a very specific exception here for one rare strain found primarily in South America, the Andes virus. This particular exception was thrust into the global spotlight during the 2026 cruise ship outbreak. If we map out the exact timeline of disembarkations, it's fascinating. Passengers potentially carrying the Andes virus disembarked in St. Helena on April 24, 2026, then Praia Cabo Verde on May 6th, Tenerife in Spain on May 10th and 11th, and finally, crew and healthcare workers disembarked in the Netherlands on May 18th and 23rd. Tracing this out maps exactly how a localized viral anomaly managed to cross multiple international borders, triggering a massive, coordinated global response. But the crucial point here is exactly how we interpret this anomaly. We have to impartially look at the current WHO and CDC assessments, treating them as our factual anchors. The WHO explicitly notes that this cruise ship outbreak is absolutely not proof of a single efficient transmission route. The exact balance of how it spread, whether it was through direct respiratory particles in close quarters, contaminated surfaces, or direct contact, all of that falls firmly under unresolved questions. Experts universally agree that this is not the next global pandemic virus. The virus still has a remarkably low transmission rate, a super long incubation period, and a very low contagiousness factor overall. So we really have to follow the data here and avoid the sensationalism. The exact interpersonal mechanisms of the Andes strain just remain under active investigation.
Finally, Section 5, containment and system management. When those environmental preventative fail-safes inevitably break down, how exactly do public health and medical systems jump in to contain the threat?
The response relies on established evidence-based protocols that act as our ultimate fail-safe. See, because there is no specific cure or antiviral for hantavirus, management is entirely about systemic support. That means immediate transfer to an ICU for mechanical ventilation and incredibly strict fluid control. For the absolute most extreme systemic failures, doctors rely on things like ECMO, which operates a bit like a heart-lung machine, or dialysis to support failing kidneys. On the macro, public health side of things, because of that massive incubation period we discussed earlier, contact tracing and active symptom monitoring have to extend for a rigorous 42 to 45-day window. That's exactly what we saw in the cruise ship response. And of course, enforcing strict environmental wet cleaning protocols to make sure no further aerosolization happens. Before we wrap things up today, I really need to clearly state that this explainer is an objective analysis of the viral system based purely on institutional data. It is absolutely not a substitute for medical advice. If you suspect you've been exposed to a rodent-infested area and you suddenly develop a fever, severe muscle aches, or especially any breathing difficulties, you must consult your local health authority or healthcare professional immediately. That diagnostic bottleneck is very real, and the timeline is incredibly critical. Please do not attempt to self-diagnose. Which leaves us with this final thought. Hantavirus isn't some malicious force. It's really just a biological system waiting for the right mechanical trigger, a closed room, a broom, and a breath. As human development continues to push further into rural environments, directly overlapping with these wild rodent reservoirs, we have to ask ourselves, are we paying enough attention to those mundane, everyday actions that bridge the gap between their system and ours? Understanding the mechanics of the system beneath is the very first and easily the most important step in keeping it contained. Thank you so much for joining me on this explainer, and I'll catch you in the next one.